Ask anyone on the street where their heart is, right? They're going to slap their hand firmly over the far left side of their chest. But is it actually there? Well, the truth is a little more central than that. And honestly, the structure of this incredible organ is way more complex than that simple Valentine's Day shape we all know. So today, we are going to completely map out the outside of the human heart.
Welcome to The Explainer. I am so thrilled you're joining us. Today, we are tackling external heart anatomy. We're going to build a comprehensive, beginner-friendly map of the heart's outer landscape. By the time we're done here, you won't just know what the outside of the heart looks like, you'll understand exactly why it's built the way it is.
Okay, so here's our roadmap for today. We'll pinpoint the heart's exact location, examine its shape and surfaces, explore its external grooves, map out the blood supply and veins, detail the great vessels and nerves, and finally, we'll wrap it all up with some key takeaways.
Section 1. Where is the heart? Let's just dive straight into this, because to understand the heart, we really first have to understand the specific neighborhood it lives in. Taking a wide view here, your heart is a thick, muscular pump situated right in the middle of your thorax. It's nestled safely right between both of your lungs in this central compartment we call the middle mediastinum. So yeah, it is perfectly central. It's not shoved entirely over onto the left side of your body like so many people assume.
Now here's where it gets interesting. The heart isn't just loosely floating around inside your chest cavity. No, it actually sits inside a very specialized, highly protective bag called the pericardium, or the pericardial sac. And this fibroserous membrane is just incredible. It acts as a lubricant, so there's no friction every single time the heart beats. It anchors the pump in place, it acts as a physical shield against viruses and bacteria, and, crucially, it physically prevents the heart from stretching out too much and overfilling with blood.
Moving on to Section 2, Heart Shape and Surfaces. Now that we know where it lives and what it's wrapped in, let's mentally pull the heart out of that sac and examine its overall 3D structure.
If you look closely at its overall geometry, you'll see the heart isn't a perfect sphere. It's actually somewhat pyramidal, kinda conical in shape. Let's look at the tip of that cone. The apex of the heart is pointed forward, downward, and just slightly to the left. It sits right about at your left fifth intercostal space. This really powerful pointed tip is formed by the lower left part of the left ventricle, which is the specific chamber responsible for pumping blood out to your entire body.
Then, on the exact opposite end of that apex, we have the base of the heart. The base is oriented upward, backward, and over to the right. It sits near the middle of your back, roughly between your 5th and 8th thoracic vertebrae, and it's separated from your spine only by your esophagus and the descending aorta. This base is formed primarily by the left atrium. Because of this unique pyramidal shape, anatomists divide the heart into 5 distinct external surfaces. Now, I know that sounds like a bunch of medical jargon, but it's really just geography. The posterior surface is the base we just talked about. The diaphragmatic surface just means the bottom part of the heart that rests directly right on your diaphragm muscle. And the left and right pulmonary surfaces, those are just the broad, slightly curved sides that face your lungs. Now, focus in on the sternocostal or anterior surface. This is the front face of the heart that's looking right at your chest bone, your sternum. It is formed almost entirely by the right ventricle and the right atrium. If you were looking at someone straight on, through their chest, this is the surface you would primarily see.
All right, Section 3, Grooves of the Heart. Let's move our map in a little closer here, because the outside of the heart is definitely not perfectly smooth. It has these specific little hallways or indentations etched right into its surface.
These grooves are known as external sulci. You can think of them almost like protective trenches. Because the heart is divided into 4 distinct chambers on the inside, those internal walls, the partitions, actually create these visible indentations on the outside. And you know, nature is just highly efficient. These sulci act as perfect, safe little pathways for the absolutely crucial blood vessels that have to travel across the surface of the beating heart.
One of the most important of these grooves is the coronary sulcus. Notice how it encircles the heart almost like a little crown. This groove physically marks the boundary between the upper chambers, the atria, and the lower chambers, the ventricles. It houses major vessels like the right coronary artery and the coronary sinus, acting basically as a main highway right around the heart's equator.
Which brings us to Section 4, Blood Supply and Veins. Speaking of those blood vessels, let's transition to the heart's dedicated plumbing system. The heart is obviously constantly pumping blood for the rest of the body, but the thick heart muscle itself, the myocardium, well, it needs its own private supply of oxygen to survive.
This private blood supply is delivered by the coronary arteries. Take the left coronary artery, or LCA for example. It branches off right at the base of the aorta and travels down those sulci trenches we just talked about, supplying freshly oxygenated blood to the left side of the heart. Keeping these very specific arteries clear is absolutely vital because a blockage right here is exactly what causes a heart attack.
Now, once the heart muscle has used up that oxygen, the blood obviously needs to be drained away and sent back to the lungs to be recharged. And that is the job of the cardiac veins. The greater cardiac venous system acts as the primary drainage network here. It collects the deoxygenated blood from the heart walls and funnels it right back toward the right atrium.
Now, this part is often misunderstood. You might think all the veins on the heart just merge into one giant drain pipe, but look at this tiny little vessel, the Thebesian vein. It's part of the smaller cardiac venous system. These tiny veins are super unique because they don't even bother connecting to the main highway. They actually empty their deoxygenated blood directly into the heart chambers themselves. It's such a fascinating secondary drainage system.
Section 5. Great vessels and nerves. We've mapped the surface and the local plumbing, so let's zoom out a bit to look at the massive ports connecting the heart to the entire body, as well as the electrical wiring that runs the whole show.
Let's see how this all builds into our complete picture. The superior vena cava is one of the so-called great vessels of the heart. It is a large diameter vein, we're talking nearly an inch wide here, that collects all the deoxygenated blood from literally everything above your diaphragm, so your head, neck, thorax, and arms. And it funnels it straight down into the right atrium. It's basically the ultimate superhighway returning blood back to the pump.
But of course, a pump is totally useless without a control system, right? The heart's rhythm and speed are regulated by an amazingly intricate electrical wiring network called the cardiac plexus. This involves fibers from the sympathetic nervous system, which acts like the gas pedal to speed your heart up, and the vagus nerve, which acts as the brake pedal to slow it down. This automated network ensures your heart adapts perfectly to whatever you happen to be doing.
And finally, Section 6, Summary and Key Takeaways. We have covered a lot of ground today, mapping everything from that protective sac to the massive vessels. So let's bring all these concepts together.
Here are your key takeaways to really lock in what we've learned. First, the heart sits centrally in the middle mediastinum and is heavily guarded by that pericardial sac. Second, geometrically speaking, it's a pyramid with a downward-pointing apex and a backward-facing base, presenting 5 unique exterior surfaces. And finally, the outside of the heart is marked by grooves called sulci, which act as those safe highways for the crucial coronary vessels that feed and drain the heart muscle itself.
So, we've thoroughly mapped the external landscape of this incredible organ. But that leaves a massive, fascinating mystery. If the external housing, the wiring, and the local plumbing are this wonderfully complex, what kind of machinery is operating on the inside of those 4 chambers to keep you alive every single second of the day?
That is exactly what we are going to be exploring next time. If you found this visual mapping method helpful, and you want to understand the complex internal machinery of the heart, make sure to hit that subscribe button for more clear, simple medical explanations. I'll see you in the next explainer.